it's the stress for me that shows up on my skin, which makes sense because there is the connection between your mind and your gut, which then connects with your skin. So if you have a high stress lifestyle, or you're an overthinker, or you're perfectionist, or you don't sleep well, right? Or whatever stress going on in your life, mentally, emotionally, physically, it's going to impact your skin.
Hey, Julia, welcome to the show today. I'm so excited to chat with you about skin health. I know the conditions we'll be talking about, eczema and seborrheic dermatitis, I've dealt with personally, and I'm sure a lot of the listeners have as well. And I know you're the expert here in Canada. So super excited for our chat today. Just for those listening that don't know you, can you tell us more about who you are, who you help, and really what got you into focusing on skin health and specifically eczema and skin rashes?
Yeah, thanks for the introduction. Hi, everyone. My name is Julia Chen. I'm a registered dietitian from Vancouver, BC, just on the West Coast here, and became a dietitian back in 2019. So that was like 7 years ago. Feels like short but long at the same time. And I initially started working in the hospital. So I was a clinical RD in a hospital here. And then I started my own practice in the end of 2020, so right during COVID. And my initial focus started with eczema because I was someone that has a history of eczema. Born with it, it was quite moderate to severe, I would say, growing up since I was young, and went through a whole route of trying to heal it, manage it, treat it with medications, and nothing really worked for me long term. And I was starting to see that my body was becoming reliant on medications just to keep the symptoms away. So I started a whole journey in 2015. This was before I started my practice, to try and look for other routes, holistic, alternative Chinese medicine, things like that, to see if that could help. And it was life-changing. So, made some changes with my nutrition, understood more about, the causes of eczema beyond genetics, which I know we'll talk about. And I'm at a point now where it's very well controlled. Obviously, it still flares up here and there because of stress, and it's not curable, but I have a pretty good methodology in place to help manage my own skin. Obviously, everyone's skin is very different. And from there, now I have a passion to help people with eczema, but it's also branched out to like gut health and fungal skin conditions as well, because everything is connected, right, at the end of the day when it comes to our bodies. So yeah, that's basically my journey and practice so far from there.
Awesome. So it came from you dealing with it for a long time and really struggling through having the eczema and all the quality of life impacts that come with that, and then really exploring like what you can do more deeply to heal it and resolve it. That wasn't just medications. So that's pretty cool. So I'm sure you've all of the things and all of the ways that someone can help their eczema. That's not just medications. You have that deep knowledge and personal experience too, which is cool. Let's talk about eczema first. I know you, in terms of skin health, you don't focus on acne. It's more about those skin conditions, so eczema and fungal skin rashes. Let's get into eczema first. I see that a lot in my practice, I'm sure, as we'll talk about, just because of the gut skin connection. I have a lot of people, more specifically with like constipation, that also deal with eczema, some psoriasis too. So can you explain to us what eczema is, and then maybe mention some of the sort of conventional treatments, and then we can get into what you think the deeper contributors or causes are that people can consider.
Yeah, so eczema, in other words, atopic dermatitis, which is more of the medical term for it, is a chronic inflammatory skin condition. So usually it shows up, differently for different people, but you see sort of these patches on your skin that are very itchy, red, and it can present in different areas. But the common areas of people with atopic dermatitis or eczema where that shows up is, in between the folds. So this is where I used to get it, like in between my arm folds, behind the knees, fingers as well. Dishydrotic eczema is a common type of eczema people experience. Anywhere really on your skin, because your skin's such a big organ, right? So eczema can show up in different areas of the skin. So with eczema, there's multiple different root causes. Initially, when you first get diagnosed with eczema and you go to your physician, for example, this was my experience personally, they will usually say, oh, it's genetic, so you're just going to have to deal with it forever and use these sort of treatments. The most common treatment for eczema topically is topical steroids. And there's different potency of different kinds of steroids to treat your eczema, depending on the severity. And then there's also some people have to go on oral steroids, prednisone, especially if it gets to a point where it's really severe and the topicals aren't working. Then there's also non-steroidal creams that people can use. So tacrolimus, for example, Protopic is very commonly used. There's new drugs coming out nowadays. There's JAK inhibitors, creams, and oral medications that people can take to help manage their eczema. But again, this is not like curing it, right? It's just mitigating the symptoms as much as we can. And there's also biologics as well. Dupixent is a pretty effective treatment for people with eczema. And usually, I would say, like clients who come to me, they have kind of tried all those things already, all those medications in the conventional route. And either they saw good relief and it kind of lost its efficacy, or they just want to look for a natural solution so that they don't have to rely on taking medications. Yeah. And then do you want me to kind of talk about more about that or the
I
root
did want to
causes?
ask, just in terms of steroids, I feel like that's probably one of the most, like, or the most common sort of prescription for eczema. Yeah. I think when people hear steroids now, I kind of think like bodybuilding and building muscle, so it gets a bad rap. But can you sort of explain like what the mechanism of action is for, like, with steroids specifically to help with eczema? Like, is it an anti-inflammatory, or what does it do? How does it kind of target it? Just to understand that mechanism.
Yeah, I guess the most basic way to explain to the audience is topical steroids are anti-inflammatory medications
Mm-hmm.
that you put on your skin to prevent inflammation. So it basically just suppresses the inflammation.
Right.
It's a treatment that is I see it as a band-aid solution, and really it is, right? Because we need to figure out what is driving the inflammation in the first place, which I know we'll get into. But essentially
Mm-hmm.
what it does, it helps, it suppresses inflammation, so that your skin is controlled in that way.
Right. Okay. Which is also, like steroids, like prednisone, are also used for inflammatory bowel disease or IBD, Crohn's, colitis, as a treatment as well, for that reason, that it helps to control inflammation. So not all steroids are, I guess, bad or connected to muscle gain and all those other things. They do have like other purposes in the medical field. With that, though, I know you've mentioned that yourself personally has gone through topical steroid withdrawal. So maybe can you talk about some of the side effects that come with taking steroids and what happens when you stop taking them?
Yes, this is a very up and coming topic, and it needs to be more aware. I think it needs to be more awareness, but there is, it's getting there. So topical steroid withdrawal is a condition caused by the overuse of topical steroids. So how this condition occurs is usually is for people that have used topical steroids for a period of time, whether it's a few years, even people who only use it for a few months can experience TSW. And that depends on multiple different reasons, like where you've applied it, how often you've applied it, the potency of the steroid as well. If it's stronger, then it gets absorbed easier. And so the symptoms of TSW, there's a very long list of symptoms, but it's very debilitating, and it's basically a drug withdrawal, because your body becomes reliant and your skin becomes reliant on an external a steroid that suppresses the inflammation, right? So if you take that away, your body's kind of like, oh, I've had this for so many years to prevent my eczema from flaring up. Now that it's gone, I don't know how to react. So your body kind of goes out of control.
Mm.
So there's excessive flaking, there's severe inflammation that's sort of widespread. We see it a lot in the upper body, chest, neck, face. Oozing is very common too with people with TSW. Then there's more of that, like that's the skin symptoms. Then there's also systemic symptoms as well. So people start to lose hair, they lose their period, their hormones get imbalanced, right? Because it affects your whole body at a systemic level as well.
Oh, wow. And is that both with the topical as well as the oral, or more so with the oral steroids?
Both.
Both. Oh, wow.
Yeah.
Okay. So, and
Yeah.
even with the topical, like let's say you had eczema and you were only applying it on your arms and your face, would you get a skin reaction in other places like the chest or stomach if you were just using topical there? Or would it only affect you in the places you applied it?
That's a really good question. So with TSW, so a good resource for anyone who's interested in learning more about it is itsan.org. It's a nonprofit organization that supports people going through TSW and kind of the lookout of what the symptoms are. And one of the telltale symptoms is flaring in areas where you didn't actually apply the steroid. So let's say you've had eczema, on your neck, right? You applied it all the time. And
Mhm.
then you go through TSW, it becomes widespread and you start experiencing symptoms in other areas too. So
Hmm.
it starts to pop up in different places.
Hmm. Wow. And for yourself, when you came off steroids, how long did that last for? And were there any tools that you used to get through that? It sounds like it would be a really uh, almost like devastating experience. I couldn't imagine just the discomfort that someone would feel and difficulty like taking a shower or even like taking a hot bath. Yeah.
Yeah, it really does affect your entire life. There's people that have had to quit their jobs because you couldn't get out of bed, right? It's very debilitating. And yeah, it's really sad actually. And I really hope that, if a doctor hears this, maybe just some awareness around the use of topical steroids because there are side effects. There's research coming out now
Mm.
on TSW, right? It's emerging. But yeah, in terms of my journey, the first few years, I would say the first year, sorry, would be the most difficult for me. So I did have the symptoms of hair loss, lost my period for a year, um, oozing, flaking, and just very uncomfortable symptoms. And then as each year went by, it started to improve more and more. And
Mhm.
then I would say by the fifth year, no symptoms at all. And it's just like the eczema that I have from being born with eczema.
Wow. Wow. Do you feel like doctors don't often like sort of talk about the risks with patients when they recommend it? Like even just from maybe your experience with clients who've gone through that?
Yeah, I would say it's very much depending on the doctor, right?
Yeah.
For the most part, yeah, I think there needs to be a little bit more conversation about the side effects of topical steroids, or at least acknowledging that it's a thing because,
Mm.
based on my patient's experience, they kind of just look at them and say, well, that doesn't exist. But there's lots of research studies coming out now and a
Mm.
whole organization that supports TSW that shows that it, in fact, is a condition that's real.
Hmm. Okay.
So, yeah, a lot there.
That's good. Okay. Um, so yeah, with that, I guess we mentioned that when someone gets diagnosed with eczema, so they're told like genetics is at the heart of it, or and you can't, you just have to live with it or deal with it. In your experience and from your knowledge, what do you think are actually the contributors to eczema? Do you believe that it is entirely genetics, or what else do you think is going on?
Great question. Yeah, so eczema is multifactorial. There are multiple different root causes. Genetics is one of them. But we also want to look at, and there's a lot of good research now that talks about this connection between atopic dermatitis and gut health, the gut
Mhm.
skin connection, even
Mhm.
the gut brain skin connection as well. Like, how does stress impact your skin and the barrier? So while genetics is a root cause, I guess you would call it, or a contributor to eczema, but we also have seen that like your gut microbiome does impact eczema, and
Mhm.
your immune system is also huge as well. So, it used to be thought that eczema is just an autoimmune condition. I don't know if you've heard that.
Mhm.
It's like, oh, it's autoimmune is just your body attacking your own skin.
Mhm.
Now we know with research that there's a connection between, let's say, you have dysbiosis in the gut, which is when you have more of that bad bacteria over the good bacteria. That can actually drive inflammation, causing your immune system to be overactive.
Mhm.
And when your immune system is overactive, it's more likely for people with eczema to have those symptoms flare up. So,
Right.
yeah, and all its like different reasons and causes for eczema to occur.
Yeah. Yeah, even well in IBS as well, like we used to just think of it as a gut brain disorder, but we're learning now that there actually is an immune system component, and a large driver of that is the like a dysbiotic gut microbiome. So in the large bowel, there's lack of like good bacteria, and too many of the pathogenic, and that causes a increase in amounts of mast cells, which are like our immune system fighter cells in the large bowel, and then you get a release of histamine, and it drives that inflammation from within the gut. So, and that can lead to like sort of non-digestive symptoms like skin conditions, eczema, hives, even acne as well. So it sounds like there's a link with both. I mean, as we know now, or you and I know pretty well, that a lot of things do start in the gut and are connected to our microbiome. But I'm
Yeah.
sure a lot of people are listening might not have thought like how strongly their gut microbiome is, connected with their skin health too. So
Yeah.
pretty fascinating. I guess even with genetics too, like, would you agree that sort of your genetics play one part of the picture, but what's going on in your life, lifestyle behaviors, nutrition, environmental factors, all of those things are going to impact like how your genetics get expressed or whether you will actually have eczema. So it's not just like, self-fulfilling prophecy or inevitable that you'll have eczema. There's all those other factors too that, contribute to it developing and how severe it is.
Absolutely. So that's like epigenetics, right? Where our
Mm.
environment and nutrition, or our nutrition or lifestyle can yeah, affect the gene expression.
Mm.
And yeah, it's fascinating to see how much your skin can improve from making simple changes, right? So
Mhm.
um yeah, I love how there's things that you can actually do to help heal your body in those ways, but it's also about kind of knowing like from how, right? And what that would look
Mm.
like.
Mhm. Would you say we talked about sort of the microbiome component? Do you think that there's a like hormonal link with eczema or not as strong?
Yeah, I do see it. So, actually, one of the topics I've been discussing, I had an episode on this on my podcast, but a lot of people experience eczema during pregnancy. I don't know if you noticed that
Oh,
in your practice
interesting.
too.
No, I haven't. Mm.
Yeah, so actually 50% of women who are pregnant experience eczema, and 10% experience it postpartum. So it's interesting. And it's even people who never had eczema before in like ever in their life.
Mm.
They start to have
Interesting.
these symptoms during pregnancy. And it makes sense, right? Because pregnancy, your hormones are all over the place.
Hmm.
You're up and down. And the link with that is so eczema, I don't want to get too like technical and confuse the audience, but eczema is as immune system condition, right?
Hmm.
And there's something called Th1 cells and Th2, which is basically your immune system cells. Th1 is like the defense team, fights off germs. Th2 is like controls the inflammation. Eczema is a Th2 driven condition. Th2 dominant is what we call it. And so usually people who have eczema tend to have a Th2 dominant condition. or yeah. So then during pregnancy, your immune system shifts from Th1, which is Th2, and typically a normal person should have a balance of both in order to have a healthy immune system. So it's interesting to see that a pregnant woman, because their immune system naturally shifts to Th2, it makes sense why eczema starts to happen, because when you have a Th2 dominance going on in your body, then it drives more of that inflammation related to eczema.
Interesting. Okay. I know for me personally, I never had eczema up until I think I was like maybe 18. And I had like some teenage acne. This was before I got into nutrition. That was one of the reasons I got into wanting to be a dietitian, and like nutrition was to help heal my skin too,
Oh, I love that.
more in a vain way, but it was a good motivator at the time. But my doctor recommended to take like birth control pill to help with acne,
Mm.
suggesting that it was hormonal. My mother was also very concerned. She was also, second motivator of wanting to care about my sexual health and preventing pregnancy. So she really pushed me to go on birth control. And I didn't want to. I was already like very much thinking about health at that time. And I was like really skeptical of just like symptoms of hormonal birth control. And I didn't want to be on that, all that. So I like regrettingly took it. And I think I took it for about a year. And I think it was tricycline low at that time. And probably like a month after I started it, I developed like really bad eczema on my face, like just on my cheeks, and around my nose, and even a little bit like on my eyebrows. And it was like the worst thing ever, because you can't cover it up with makeup. It's itchy. It just always like you're always thinking about it, worried about how it looks. In pictures, it was like, what is wrong with this this girl? Like her cheeks are so red. I look like I was just like
Yeah.
constantly flushed. And I don't know if it was just me, like, because I do believe that, what's going on in our mind and, suppressing emotions and feeling anger about stuff can, manifest into different disease states or conditions or weird things going on in our body. I don't know if it was
Mhm.
that, and or it was like something with the hormones in the birth control pill. But after I stopped the pill, it went away within like a month or two. So
Wow.
it was, yeah. And I always wonder like
Yeah.
what the cause was, or really if it was linked. I do think it was linked. I don't think it was just coincidence, but yeah, I don't know if you've ever heard of that happening to anyone, or it being linked with birth
Birth
control
control?
or even another medication. Yeah.
Yeah. Actually, yes. Yeah.
Yeah. Okay. So
Clients
it
who've
wasn't
gone on
alone.
birth control. Yeah. Yeah. Gone on birth control, noticed their eczema, or yeah, I mean, like sebderm can also appear here too, right? Where it's like
Hmm.
oily area. So
Yeah.
yeah, they did notice their skin flare up while being on birth control, and even after coming off of it as well, because it takes time, right, for to
Yeah.
the
You know your
hormones to
seasons.
readjust again. But yeah, I guess there's also a good connection between the gut and the hormones and your hormones.
Hmm. Hmm.
Um, so yeah, it makes a lot of sense as to the symptoms that can show up on the skin because of hormonal imbalance.
Yeah. Cool. Well, yeah, I definitely resonate with how awful it is and difficult to deal with. And I just had it on my face, so I can't even imagine like other parts of the body too. All that to say, like, so you've gone through the journey yourself. You're obviously still, needing to work on these things. Like you said, things still flare up time to time, and obviously you can't just like give up all your good changes once things
Mhm.
improve, because you know that
Yeah.
things may come back. And you've worked with lots of clients to this point. What would you say, like for someone listening who's dealing with eczema, are sort of the main avenues of helping manage it, or places to explore in terms of controlling their eczema without needing to go the conventional route and use topical or oral medications?
Yeah, I would say first and foremost, if you're trying to manage it on your own, the first thing is to understand your triggers. And I know this is a hard thing because a lot of people, at least my clients, will be like, well, I don't know my triggers. I would say start off with just writing it down when you experience flare ups, because it can tell us a lot. So, for example, eczema is a very much related condition to stress. So if you do flare up during times of the month, look at where your stress levels are at. And that could be a good starting point as to linking your eczema to triggers, right? So that's one way. And then also looking at your overall lifestyle and nutrition is very important. So, looking at your diet, are you eating more processed foods? Are you eating more sugar? Those are big triggers for inflammation, not just with eczema. Or are you focusing more on, protein, fats, and fiber, eating enough? I tend to see a lot of people with eczema, they're afraid of food. And I can see why, because in the nutrition world, a lot of people talk about avoiding this and avoiding that. And
Mm-hmm.
you have to go, on an elimination diet, which I don't agree with. And so nutrient deficiencies are common for strict diets. So looking at whether or not you're eating enough and having those balanced meals, and that can guide you in supporting the healing process.
Mm-hmm. Okay. Would you say like there are any specific foods that can contribute to eczema, or do you think it's more just within like, because it is like an immune driven condition, obviously like an anti-inflammatory diet can help. So is it just more about diet patterns, like being, trying to crowd out the inflammatory foods with good quality like whole foods, or are there any like specific foods that actually do trigger eczema?
Yeah, good question. So there are specific foods that do trigger eczema, but it also again depends on the person. So some people, when they eat dairy, nope, their eczema flares up, and others it's okay.
Mm.
Right? So then it's listening to your body, and that's really the gold standard of like testing whether or not you have food sensitivities raised. If you want, try elimination for a few weeks, nothing longer than that, and reintroduce it back with guidance from a dietitian, for example, and then seeing if you do have a reaction. But typically, it's sugar is a pretty big one.
Mm.
A
Mhm.
lot of sugar in your diet, it will cause eczema, especially if it's consistent sugar intake over time. Dairy sometimes, depending on the person. Eggs can also be a trigger, but again, I'm saying this depending on the person because I don't want people to start avoiding foods.
Mhm.
But generally, yeah, dietary patterns. So, like, looking at how much protein, fats, and fiber you're getting at every single meal, meal timing, right? Are you eating on time? Or are you skipping meals? Like, all of that impacts skin healing and your digestion and your hormones. So,
Mm.
we're looking at the bigger picture.
Yeah. So in your experience, like what just roughly, I know you'd have to like look back, comb through files, but maybe just an estimate, how many percentage of your clients that you've had would you say like a true food intolerance has actually been one of the key drivers in their eczema?
You know what? Less than what people would think, actually. I would say even less than 10%.
Wow. Okay.
And
It's not a lot.
90%, it's not a lot, yeah. And 90% of the people stress triggered.
Yeah.
I know everyone hates when I say that. Stress? What? What am I going to do?
Yeah. Yeah. Would you say that most people, when they come to you, they're avoiding certain foods, or they're thinking that their eczema is driven by a food intolerance? Is that pretty common?
Like 100% of the time, yes.
Yeah. Yeah.
Mhm.
Yeah.
Yeah. Do you see that in yours too?
Oh yeah, for sure.
Yeah.
Yeah. Yeah.
Yeah.
Everyone loves to blame the specific food, but I'm with you that there's just so much going on, like with IBS too. It's largely driven by what's going on in the large but also small bowel. But those are like big organs that need different like nutrients to
Mhm.
function at their best. So if someone is eating a very restrictive diet, that can contribute to nutrient deficiencies and cause issues with motility and enzyme secretion and all the things we need for digestion. And it also then contributes to that dysbiotic state and a reduced resilience in the gut microbiome, which drives inflammation and makes symptoms worse. So yeah, for most people, it's not just food intolerances. Like sometimes that can play a role, but there's deeper reasons for their symptoms. So I think that a lot of people don't get that. And from what you're saying, it's probably not like they're not getting that from their doctor because their doctor's saying it's genetics. I'm assuming it's probably a lot of content that they're seeing on TikTok and Instagram, making them scared of every food, but
Yes,
thinking that that's what's driving their eczema, right?
especially these days. Yeah,
Yeah.
with the noise
Yeah.
and stuff. Luckily, we're here as dietitians to debunk that, you know?
Exactly. Exactly.
Yeah,
Yes. Yes. And
yeah,
find what's right for you. Because, like you said, it's eggs may be a trigger for some people, but they're not like a universal trigger, or dairy as well. And
exactly.
and like avoiding so many foods or being scared to like eat out at restaurants or take a bite of your salad like that then drives stress, which then can make the eczema worse. So there's
Yes.
just so many downsides to just kind of blindly cutting out food and being restrictive and just trying to piece together stuff that you see online.
And
Yeah.
consequences with adding them back later on, especially if you've been
Mm,
avoiding them for so long as well. Like there's a higher
mhm.
chance of you developing an actual allergy to these foods.
Okay. You see that as well? Your practice too?
Yes. Yeah.
Yeah.
No, I've seen a
Interesting.
couple people who've been on very restrictive diets that end up having allergies. So
Hmm.
it's a slippery slope. Got to be careful with the food avoidance.
Yeah. Yeah.
Yeah.
And also too, like that, just speaking more about the state of your gut microbiome. As we said, like it can contribute to a higher level of mast cells, which means the immune system's in like overdrive. That
Mhm.
can then make you just react to a lot of different like chemicals or compounds in food, and actually develop a lot of food intolerances just because of like your microbiome being in such a unhealthy state. So you can develop more food intolerances by being so restrictive. So not necessarily allergies, but food intolerances. I don't call them sensitivities, more food intolerances, but yeah, there's that too. So all that to say, don't blindly cut out foods. It is best to work with a dietitian, someone who specializes in your specific condition, eczema or IBS, because it can just help you save so much time and get relief faster, and not make things worse by putting it off and just blindly trying strategies. So that's my little
Yes.
plug there for
Saves the
dietitians.
stress, saves the stress and time on the patient, right? Which is so
Yeah,
important.
yeah,
Yeah.
for sure. In terms of the nervous system component, I know for you as well, like that was, I don't think you've mentioned it so far in our chat today, but that was one driver for you. I think I was reading through some of your content, which is amazing. I'll link your Instagram in the show notes. But you mentioned just for you being in sort of growing up in like a high stress environment, that you believe that was one of the contributors to your eczema as well. Do you want to share a little bit more about that and what the connection there is?
Yeah. So about like my journey and how I kind of noticed that.
Yeah, yeah, exactly.
Yeah, so my eczema, thinking back, would always get really bad during my university years, which was the most stressful time for me at that
Mhm.
time, trying to
Mhm.
get into dietetics too, right? Just so many science courses. And I remember I would always get flare ups around during that time. And I didn't understand why. And now thinking back, it makes a lot of sense because I was at a highly stressful lifestyle
Mhm.
during those years. Like I was in school studying to become a dietitian, all the science courses, chemistry, biology,
Mhm.
right? Trying to pass. And I definitely was not taking care of my body as I am today. You know, when you're in your
Mhm.
20s, just trying to survive, right? And then also, like, there's a lot of stress happening at home as well. So, I think all of that definitely, or for sure, made my eczema flare up quite bad during those years. But
Mhm.
during that time, I didn't know much about mind body connection or nutrition. I was just using topical steroids because that was what I knew at that time, is just
Mhm.
to use a steroid to suppress it. Fast forward to today, this took years of really understanding my body and seeing that personally for me, my eczema is triggered by stress. Food, surprisingly for me, it doesn't actually do anything.
Mhm.
Of course, if I'm eating loads and loads of sugar or if I'm, indulging on ultra processed foods, then yeah, maybe I'll have some flare-ups here and there, but generally it's the stress for me that shows up on my skin, which makes sense because there is the connection between your mind and your gut, which then connects with your skin. So if you have a high stress lifestyle, or
Mhm.
you're an overthinker, or you're perfectionist, or you don't sleep well, right? Or whatever stress going on in your life, mentally, emotionally, physically, it's going to impact your skin. It actually weakens the skin barrier, which is why when people are stressed at work, they start to itch. They're like, why am I itching when I'm at work?
Mhm.
It's because you're feeling stressed from, whatever's happening at work. But there's definitely a connection between the mind and the body. And it's something that
Yeah.
I really trying to, educate more people on, because I think it's one of the things where everyone knows that the mind and body is important, or the mind's important to
Mhm.
nurture, but it's the most difficult. So, and then there's that connection with like the vagus nerve, right? The brain and the gut. So if you're
Mhm.
stressed in the mind, you're going to have a stressed gut. And what happens when you have a stressed gut, your digestion shuts down, right? So you're not actually digesting and absorbing all the amazing foods that you're eating when your digestive system isn't optimal. So very important to work on stress.
Mhm. Definitely. Yeah. Yeah, I definitely believe highly in that condition. I've mentioned it on the podcast before, but I really love the book When the Body Says No by Gabor Mate. Have you read that?
No, but I love him. I love
Okay.
his, yeah.
It's a really good one. I think you would like it. But yeah, he basically just goes through like various conditions, diseases, cancer, inflammatory bowel disease, multiple sclerosis, and just links it to, like, he uses a lot of different case studies in the book, but links it to different personality types and how people like deal with emotions and even their like sense of self. And in almost like
Mm,
every condition, just repressed emotions or not feeling like having a sense of independence or being able to say no, or like run their own life. It's often linked with all these different conditions, and just for the reason you said, where it just like drives that constant sense of stress, which then causes the immune system to go haywire and things kind of run out of control. So it's a really good book in terms of the mind gut connection. Help me think about things in a different way, and again, remember that it's not always just the food that's on our plate. Like, there's so much more going on
mhm.
that's contributing to how we feel and what's going on in our body. So yeah.
I saw a video that he posted. I think he was just speaking on someone's podcast or something like that, and he shared that actually, statistically, women are more prone to chronic symptoms because of the need to care for other people,
Mm,
um, the overworking moms and stuff like that. So I thought that was interesting, because he was sharing how certain personality traits, especially women, tend to have more of these sort of chronic conditions because of how we are. I don't
yeah,
know if
I
you saw that,
do.
but I was like, oh, that's interesting.
Yeah, I do agree with that. I've definitely heard that before. I've heard that it could be partially skewed just because women, although I don't know if I totally agree with that anymore, but women tend to like seek help more. So we'll go to the doctor and we'll
Oh
get a
yeah,
diagnosis
that's
and we'll
true.
look into things versus like the male personality, depending, obviously it varies like based on the culture, but let's say more like North American tend to like push
Yeah,
things off and like, I can deal with it. I'm fine. So maybe skewed a little bit, but
yeah, that
I
makes sense
do.
too.
Yeah.
Yeah.
Yeah. Partially contributed, but that makes sense. Well, we could talk about eczema, I feel like, all day, but we will move on to the other skin conditions. So, another thing that you're an expert in is fungal skin rashes. I think the most common ones being seborrheic dermatitis. We could talk a little bit about tinea versicolor. But yeah, let's talk about seborrheic dermatitis first. So essentially, I know that as like being dandruff on steroids. So it's not just like simple dandruff, but it's like there is a lot of flaking, a lot of itching. It can occur, I think, on the scalp, but also, like you said, even eyebrows, cheeks, ears as well. So, can you explain a bit more about what seborrheic dermatitis is and sort of what we know causes it? And then we can get into maybe a little bit more about like the root causes and contributors.
Yeah, so seborrheic dermatitis, or we call it sebderm, is similar to atopic dermatitis actually. It's an inflammatory condition. It just shows up in particular areas. So as you mentioned, dandruff on your scalp, itchy scalp, but basically anywhere where there's oil production. So you can actually see sebderm not only on the head, because obviously our hair gets greasy, but also like these areas. So like around your cheeks right here, right?
Mm-hmm.
And in between your eyebrows, because that's where it gets really oily, around your nose as well. That's where you typically sort of get that symptoms of sebderm. And it could be flaky and scaly, but it could also be red and inflamed as well. And then dandruff is also what we see pretty commonly for sebderm as well. It can go hand in hand with eczema. So I have clients who have eczema who also have sebderm. They're both inflammatory conditions. Now, the pathogenesis, the causes for sebderm is a little bit different than eczema. It's caused by when there's an overgrowth of yeast that your immune system is reacting to. So when there's an inflammatory reaction with the yeast and the lipids on your skin, that's why sebderm occurs with the inflammation. And then the treatments we can talk about, but it's different than eczema because it's involved with the yeast, whereas eczema is, as we talked about, genetics and microbiome imbalance and other root causes.
And the yeast, I don't know if I pronounce it correctly, but I think it's Malassezia yeast, like is naturally occurring on the skin. But in seborrheic dermatitis, there's like an overproduction of it, which then contributes to the symptoms. So like everyone has that yeast. It's just an overgrowth of it that causes sebderm.
Yeah, so Malassezia is a yeast that grows on your skin naturally, but when there's overgrowth of it, then that can cause symptoms like sebderm, but it's more so the immune reaction to the yeast. For
Oh,
example, like Tinea versicolor is the same thing. It's an overgrowth of Malassezia yeast, but it's
oh, I
just the
didn't know they were
overgrowth.
same. Oh, okay.
Yeah. It's
Huh.
just the overgrowth of the Malassezia is what happens in tinea versicolor and has a different presentation of how it shows up on the skin. Whereas sebderm is the same yeast, except that it's an immune response to the yeast. So it's more inflammatory than it is for tinea versicolor. And it kind of shows in that way too, because you can have tinea versicolor and not have any redness. Oh, there's a fruit fly.
Okay. And what are the symptoms of tinea versicolor as compared to sebderm?
Yeah, so tinea versicolor is really interesting because you can probably see it, especially during the summertime. So if you go get a tan outside in the sun, and usually when you don't have tinea versicolor, your skin typically should tan, evenly, unless, of course, the tan lines with your bikini.
Yeah.
But with tinea versicolor, you start to get those hypo and hyperpigmentation. So you'll see these round patches, usually on the trunk, so your upper body, on the back, on the arms. Is where those patches will start to show. And it's evident during the summertime because those particular spots don't tan from the sun.
Oh, interesting. Okay. So it more just shows up as like a visible like manifestation versus like itchiness or flaking. Is that right? Like it just your skin looks different, but you don't really feel any symptoms or trying to
Yeah,
understand.
you can feel a little bit of itching,
Okay.
mild itching, but I find that with tinea versicolor versus sebderm, it's not as itchy as sebderm because
Okay.
it's not as inflammatory. So it can be itchy for some people, but it's not as significant compared to eczema or sebderm.
Okay. I see. And with seborrheic dermatitis, because it is that like fungal overgrowth, from my knowledge, like one of the common treatments for it is like an antifungal shampoo. Is that sort of the main conventional treatment, or is there anything else that people would be prescribed, like oral antifungals or yeah?
Yeah, I would say the most common treatment, and really what the research says is the most effective, is using a topical antifungal. So, like a shampoo, for example. In certain cases, they will be prescribed an oral antifungal, like a fluconazole, for example.
Okay.
And it can work, right? It is effective for people. But then I've also seen clients who've done those sort of medications and treatments and it still comes back. And this is where the element of like the microbiome and supporting your body from a nutritional standpoint can help with the symptoms. While the research, like there's no like RCTs of exactly what that would look like for sebderm,
Mhm.
but because we know that there's a connection between your microbiome and your immune system and your skin health,
Mm.
you can see some of those sort of improvements with the symptoms.
Yeah. Okay. So I mentioned I only dealt with eczema for that short spurt, but seborrheic dermatitis was something I had like as a teenager and then in my adult years too. And it's very annoying too because it's just that like constant itching, and then you get the flaking, which is embarrassing. And then if it shows up like even on your face, it's hard to cover with makeup, and it really terrible. I found like earlier on I had to use Nizoral, which is I think 2% ketoconazole or something, so an
Mhm.
antifungal. Helped at the time, but over time, as I like working as a dietitian, same as you, getting more into like integrative strategies and exploring other things. For me, I found once I was really mindful, I actually do have a couple food intolerances. So soy for me and gluten, if I do have them, like even just a little bit of soy, some like tamari, or little bit of tofu in a salad, I find the next day I get like really itchy scalp again, and it
Oh,
flares up.
interesting.
Yeah, weird one for me. The other
Yeah.
one is like sugar, so I just naturally I don't
Mhm.
love desserts and sweets, but if even at my birthday I have a little bit more sugar or something, I will notice like the itching comes back a little bit. And then this has been well controlled now, but a few years ago, I remember I went to Europe and was dealing with like constipation, contributed to by long travel and flights and all that. And my sebderm like flared up, and I had to use the Nizoral again, which I think was linked with constipation. So thankfully, I like with what I do now and all the things that I know, it's like very dormant. I haven't had to use it in a long time or have any symptoms, but I know for me, there's more to it than just, or there's more that's helped it than just the shampoo. Like I know there's
Right.
different diet contributors and the gut connection too. So
Yes.
all that to say, yeah, from your experience, would you say that the drivers for eczema and sebderm are similar, or is there anything that's more linked with seborrheic dermatitis, flare-ups and manifestation specifically?
Yeah, I've noticed that with sebderm, it's very much related to like someone's fungal profile and their immune system as well. So what I've seen that have worked really well in my practice is when we start to look at the gut microbiome and their intake of sugars, which is a huge driver for yeast, right? Because yeast loves sugar. It thrives on sugar, like candida, right? Similar, a different type of yeast, but it thrives on sugar and carbs, refined carbohydrates. And so I've seen a really interesting connection where when we start to work on lowering the sugar intakes, we're not feeding the yeast
Mm.
and potentially using some herbals to help with getting rid of that excess yeast that's, growing in the body. It's actually helped with the symptoms of sebderm.
Interesting. Okay.
Yeah. So there's some really interesting tools beyond just, the fluconazole and the fungal shampoos to heal from sebderm in addressing it from like an internal perspective.
Hmm. Okay. And you feel like sugar intake is one of the main drivers for it then, and just being mindful. Do you get people to like cut out sugar like entirely for a period of time, or sort of I think it's the typical like candida diet where it's like no carbs and you starve the yeast? Or for you, is it more about just kind of bringing the overall sugar down and then getting in more good quality carbs, maybe natural sugar that's bound up in fiber and starches like in fruits and vegetables? What does that sort of look like?
Exactly. It's removing any sugars that are overly processed. So when I say overly processed, it's like cakes and pies and desserts and things like that. But if it's like fruit and fruit, like typically if you looked up Candida diet, they actually recommend you to avoid high sugar fruits.
Yeah.
However, it is very restrictive and it doesn't work for everybody. So, again, it's listening to your body again. If you eat a mango and your scalp is itching like crazy, okay, then maybe we need to just reduce it a little bit
Hmm.
just so that you can manage the symptoms, right? But yeah, typically it's reducing sugar that's overly processed and then it's increasing protein and fiber to support your gut on the protocol.
Yeah. Okay. And in terms of like the gut skin link, what are your thoughts on constipation being maybe linked with seborrheic dermatitis? Do you feel like that is a contributor? And if so, why you think that that is, or what's the reason behind it?
Yeah. So I guess first with constipation, constipation is considered if you're not having at least one bowel movement a day. Just in case your listeners are like, what is constipation exactly? I have a couple people where they're like, oh, I poop every 3 days. That's normal. And I'm like, no, that's constipation.
Yeah. Or even if you, like, I have people who get the urge to go, but it's type 1, 2, Bristol chart, little pebbles. Like you're really not
Yeah.
emptying out what you're taking in, even if you're moving your bowels every day. So it's a lot of stool
Yes,
backup, things getting stuck in there.
exactly. And that's a driver for any sort of chronic symptoms or inflammation, or it can be, right? Because your bowels are the main system that eliminates toxins, metabolites that need to leave your body, right? And so if you're having constipation, you're not allowing sort of those toxins and the metabolites that aren't meant to be in your body. It's a natural detox, right? So if you're not eliminating every day, then it just stays in your body and it's going to create more microbiome imbalance, right? It's going to drive your immune system as well, because when there's more toxins that are circulating, it's going to affect your immune system too. And that in turn will affect eczema, sebderm, because they're both immune related conditions and they're both inflammatory.
Hmm. Okay. So it is good to be going every day and
Yeah.
emptying out properly. Yes. Which I know I talk about it all the time with my clients.
Same.
There's nothing better than a good bowel movement every
Yeah.
morning. Sets your day up for success. Aside from, yeah, the gut connection, sugar, would you say anything else contributes to sebderm, like the nervous system component, hormones? What else are sort of the drivers of that condition?
Yeah, definitely stress is a big one too. You'll know when you itch when you're stressed, your scalp starts to itch
Mm-hmm.
if you're prone to sebderm. Stress kind of impacts any condition, right? Not just beyond just, sebderm, tinea and eczema. It's flares up people with IBS, right? And IBD. So managing stress is a part of like a protocol when it comes to healing from sebderm, especially if you're someone that notices that your symptoms do worsen with a high stress lifestyle or high stress days. You're noticing more itching or more inflammation.
Mm-hmm. Yeah, which is why, like you said, it can be helpful to keep a food and symptom journal, like make note of the foods you eat, but the symptoms you experience, severity, whether it's itching or even gut symptoms too. I have people keep note of bloating, pain, bowel movements, even for like a couple weeks. It can just be helpful. If not, even if you don't find any trends, I think just like getting a little more awareness of how you feel during the day and how often you are having these symptoms and even what you're eating, it can be helpful as well. We don't want to like obsess over it,
Yeah.
become too neurotic. But if you feel like you aren't always aware of what's going on in the trends, I think it can be really helpful. And then I don't know if you're in your practice, you get clients to do that, but I always have new clients keep a pretty detailed journal, at least for a week or two, just to
Yes.
start getting that data to understand what's going on. So it's really helpful then when you start to work with a dietitian or even, if you're seeking a diagnosis, to share it with a doctor as
Right.
well.
It's good to always have the data, right, written down because it's hard to remember everything. Can't even
Yes.
remember yesterday's list of things that I did. So, yeah, it's good to have a tracker
Yeah, exactly.
initially. Yeah.
Cool. So just to wrap things up, for someone listening who's dealing with a skin condition, whether it's eczema or seborrheic dermatitis, what would be your takeaway for them for this episode? What would you want them to walk away with, thinking about, reflecting on, taking away from today?
Yeah, I would say there is hope in healing from both. I think a lot of the times with eczema and sebderm, people feel very uninspired or they're just kind of at their wits' end because they are told that they have to live with it forever. And I'm here to remind your audience and everyone who finds this episode that eczema and sebderm skin conditions can be managed with the right tools in place, whether that looks like it's changes in your nutrition or your lifestyle. Like, there is a lot of good evidence that it can help. So don't give up on that. And don't forget to also ask for support as well, because it's, from our conversation today, it's quite complex. I feel like we just kind of touched the surface, but there's so much more, understanding the person's body and genetics and everything to really uncover how to fully control these two sort of conditions.
Yeah, exactly. I think it's always good to remember like the body is so complex and there's lots of things influencing different systems, and yeah, there can be a lot going on. I think working with someone who has a lot of expertise in it can be like, just give you that external look into things can be really helpful to guide you, and also, be a lot more, I mean, depending on who you work with, but save you a lot of time and headache rather than just following what's online or social media, TikTok, because there's a lot of like wrong information or fear mongering information on there as well. Yeah. And there's more to it, as we said, than just medications or just what your doctor can help you with. So I think having a team, an interdisciplinary team, dietitian for the food and the lifestyle piece, even therapy for the nervous system piece, lots going on there that you can get help with.
Yeah.
So yeah, this has been an awesome discussion today. I think there'll be a lot of light bulb moments for people listening. For those listening, if you do have any questions for myself or Julia, you can leave it as a comment on this episode. And just to wrap things up, do you want to share how listeners can get in touch with you if they want to learn more?
Yeah, so I'm pretty active on Instagram. You can find me at juliachien.rd. Send me a message anytime if you have questions. I also have my own podcast too. It's called the Eczema Warrior Podcast. So if you guys are curious more about skin health, I also talk about other topics as well. I release weekly episodes on there.
Cool. Awesome. I will link those as well in the show notes. And then I think we talked about maybe a couple books today and some other resources. So I'll link those too in the show notes. Awesome. Well, thank you, Julia. This has been an amazing discussion. And yeah, thanks again for coming on.
Thank you so much for having me.
All right. Take care.